Welcome to POC Nurse. My name is Gozi, and in this video, we're going to talk about cardiac trauma for the CCRN exam. So, cardiac trauma could be any of three things. It could be caused by blunt injury to the chest, it could be caused by a penetrating injury to the chest, or it could be caused by injury to the great vessels, such as the aorta. For the purposes of the CCRN exam, we're going to talk about myocardial contusion. Myocardial contusion is caused when blunt force is applied to the chest. So, blunt force could be from something such as a ball at a baseball game, um, a fast-going ball. It could be a hockey puck at a hockey game. It could be caused by really vigorous CPR. You're pushing down on that chest hard and fast. It could cause a myocardial contusion. It could also be caused, for people that work in warehouses, if something really heavy falls on their chest, that could cause a myocardial contusion. A person that gets kicked by a big animal, like a horse, if a horse kicks someone in the chest, that person could have a myocardial contusion for sure. Other things are, like a car accident, if someone gets hit by a car or someone is on a motorbike and they get hit and they fall off, maybe they fall on their chest or they get hit in the chest somehow, that could cause a myocardial contusion. Another thing that could cause a myocardial contusion is a seatbelt in an acceleration deceleration situation, meaning the car is going really fast and the person has to stop suddenly. The seatbelt could tighten on the chest. The person could hit their chest on the steering wheel, also leading to a myocardial contusion. Now, a patient that has had a myocardial contusion, when they come in, of course, they're going to explain, what happened. I got kicked in the chest by a horse. I was in a car accident. Whatever happened, something happened to my chest. Now I'm having chest pain. Patient will also, of course, complain of, they will tell you what happened and they'll tell you what they're feeling because of what happened. So they'll complain of chest pain, they complain of shortness of breath, and they might be having, palpitations. When we look at the assessment of the patient might be tachycardic, and this tachycardia remains even after you've given fluid to the patient. Patient may be tachypneic, patient may be hypotensive. And when you look at the chest, you could see bruising on the chest wall. You could see that something hurt that person on the chest. Person might have tenderness on the chest when you touch it, when you palpate it. And the patient might also actually go into cardiac arrest because they might have a fatal ventricular dysrhythmia, rhythm disturbances. So these are some of the symptoms that a patient may present with that has had blunt force injury to the chest. For the CCRN exam, it's important to know the difference between a patient presenting with a myocardial contusion because it's a medical emergency, the difference between that and the difference between a patient presenting with pericarditis because they both have similar symptoms. A patient with myocardial contusion has about 48 hours before there's a possibility of death. So that person could die within 48 hours. So it is an emergency. The patient with pericarditis, not so much. Now, the patient with pericarditis, I spoke about pericarditis in a previous video. A patient could get pericarditis after they've had cardiac surgery. They could have it after they've had a myocardial infarction, after radiation, or just for an unknown reason. Now, it doesn't have as worse of an outcome as the patient that has a myocardial contusion. So now both patients will present with chest pain. Both patients will present with pain on inspiration when they take a deep breath. Both patients will have difficulty breathing. Both patients may have a low grade fever. Now, the patient with pericarditis has ST elevation everywhere. Pericarditis affects the whole heart. The patient with blunt injury to the chest, the patient with a myocardial contusion, will have ST elevations only in the area that's affected, only in the area that's bruised, not everywhere. Now, of course, the patient with a myocardial contusion, we have evidence of injury on the chest. I think that would be one thing that would quickly tell you whether this patient has had, injury to the chest, or if this patient is just having pericarditis. I would think so. So these are the, similarities and differences between pericarditis and the myocardial contusions, and these are important to know for the CCRN exam. Now, of course, treatment for pericarditis will involve anti-inflammatory medications, antibiotics, steroids, and pain medication. For the patient with the myocardial contusion, patient is going to have something for pain, and then of course we're going to monitor the patients for complications from being, hit in the chest with something blunt and with much force. So for the patient with myocardial contusion, we of course want to watch their rhythm to make sure it's normal and to catch any abnormal rhythms as they occur. Because this patient could have cardiac tamponade, patient could have ventricular rupture, the patient could have a valve rupture. Oh, one thing to mention is that when there is any kind of injury to the chest, the places that will likely get injured first or the most are those areas of the heart that are closer to the chest wall. That is the right ventricle, the aortic valve, and the AV node. Those will most likely get injured the most or first because they're closer to the chest wall and therefore easier to hit when something hits the chest. So while we're monitoring this patient, other complications to look out for are conduction problems, rhythm disturbances. We also want to keep an eye on the patient because the patient could go into cardiogenic shock. Because when the heart is injured and is not, working properly, if it's not pumping effectively, then blood is not moving around the body, the organs are not getting perfused. At some point, patient might get hypotensive and go into shock. This is where we're going to stop in this video about cardiac trauma for the CCRN exam. I hope you found this video helpful. Please like, share, and subscribe, and I will see you in the next video. Bye bye now.